mute people.
Okay.
You go ahead, Jamie.
You didn't want to get this.
Are we a go?
That's right.
Ingrid, are we recording?
We are now recording.
All right. This is Dale Heisinger calling the Board of Health meeting for January 20th. I'm going to do a roll call so we can be sure that we have a quorum. Jamie, you're here. I see you.
Here.
John Guyman.
Here.
Kyle, I see you. Noel.
Here.
Good. And Dale Heisinger is here. Before we get on to the business, I want to welcome Christy Minnie and Cindy Wolf to the Board of Health. We look forward to working with you over the next few years for the health and safety of our community that we all love. I thought we would introduce ourselves as board members and with a little history, make it brief, and I'll start. I'm Dale Heisinger. I'm a retired pediatrician, live on Orcas Island and have been for 17 years. I took over a 2-year position on the Board of Health in 2012 because of a vacated position, but I started my first term in 2014 and the second term in 2018. So it has been a wonderful experience. It's a great board with wonderful people working very diligently on behalf of all of us. All right. Noel, do you want to take it?
Sure. Thanks, Dale. I'm Noel Monin, and I've been serving on the board. I don't even know how long. It's been a few years. Had the privilege to take the appointment from a position of the town council. One of 5 members on the elected body of the town council representing the town of Friday Harbor. We allocate and volunteer for various boards and committees, both in the county and in the town. And I've opted into this position, and the board is, and council members have graciously accepted. And I've been here for a few years, and appreciate the opportunity to serve the public. Thanks.
Kyle.
Thank you, Mr. Chair. Good morning, everybody. I'm Kyle Davies. I work as a paramedic with San Juan Island EMS full-time and part-time in a new venture on a federal grant for chronic care management for the whole county. I think this is my 4th year on the board as an at-large member appointed by the council, and I look forward to the opportunity to work with our current and new members on council and to continue to do the good work. Public health is something of a new endeavor, or newer endeavor for me, but it's really helped. My pre-hospital experience has helped in this role and vice versa. So grateful for the opportunity.
Thanks, Kyle. John Guyman.
Yes, I've been on the island for about 30 years already now. Spent 21 years in academic medicine and family medicine. Practiced here as a family doc from 90 to 97. Retired from practice then and worked full-time in research and writing on health policy and healthcare system reform, and have enjoyed working with the excellent Board of Health here for a few years, so I'm glad to be here.
Thanks, John. Jamie, do you want to give your perspective from the Board of Health? I know everybody knows you that are on the council.
Sure. Jamie Stevens, District 3 council member and current vice chair of the Board of Health. And this, sometimes you wonder what we do, but in the past year, we know what we do. You learn fast. So welcome to the Board of Health.
Great. Thank you all. With that, we'll move on to the business of the Board of Health if there are no questions. First on the agenda is approval of the agenda. Do I hear a motion to approve the agenda?
So moved.
Second.
I'll second.
Discussion. Those in favor say aye. Opposed?
Aye.
Aye.
Next.
Hey, Dale,
Yeah,
you got a little quick on me. I was hoping to add an agenda topic on some bills of interest / state legislative updates. And so if we can do that after the COVID response update, that'd be great. I did place that in the Teams file folder for everybody to look at, but it was one of the requests from last year is to keep the board informed on maybe some bills of interest that have potential impact on the county and the health. And so it's a short list. There's probably more out there, but those are kind of the big three that I wanted us to touch base with the council on. And I know that, and so just want to make sure that gets on the agenda.
I will.
I'll rescind my motion and make a new motion to adjust the agenda to accommodate Director Tompkins' addition.
Second to that.
Second, Jamie.
Okay, any discussion? Those in favor say aye.
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 Opposed? Thank you. Thanks, Mark, for pointing that out. Approval of the minutes from our December, I think, 16th meeting. Any additions or corrections to the minutes? Do I hear a motion for approval?
Hearing no change.
Go ahead.
Go ahead.
Move approval of the minutes.
I don't want any fighting over the
I'll
approval
second.
of the minutes. Is there a second?
I'll second.
All right. Any further discussion? Those in favor say aye.
Aye.
Raise your hand. Opposed? And so I don't think we have any missing members today, do we? So we don't need to excuse anybody. Do we have public comment? Ingrid?
Dr. Heisinger, I haven't received any public comment.
Okay, thank you. No
So-
call-ins?
Dale, we have we have a list of call-ins, and so I don't know if Jamie and or Christine want to go through the list of maybe some of the folks who have called in to see if there's any comments.
I don't have any, I don't have that list. So Jamie, if you have it, do you want to proceed?
Sure.
Identifying them and listening? Thank you.
So I've got Paul Hart. Do you wish to address the Board of Health?
I beg your pardon. No, I don't. I'm just here observing.
Okay, thank you. Just lost my screen. Let's see. Sorry, my mouse is a little quick today. Okay, that's Dr. Guyman. There's a phone number that ends in 9414.
What's the question?
Do you wish to address the Board of Health? This is public access time.
No.
Great, thank you. And then I have a number that ends in 2042.
I don't wish to address the board, but thank you for letting me listen.
Okay, thank you. That's it.
No others?
No others.
Okay, Jamie, thank you. So let's go ahead and proceed with our committee updates. Jamie, you and Mark on the ACH.
You know, we have not had a meeting since December, since we updated you in December on the ACH anyway. I've got a training coming up for the board, but that's it.
When is that training?
It's in the first part of February.
Okay.
So
Mark?
I have a little update from the ACH. So I think at the last meeting or the meeting prior, we had talked about the ACH acting as the regional hub for care coordination project that the state had put together. That project continues. And so we have received the food kits and the care kits Those care kits, these are for folks who are in home isolation or quarantine and don't have access or need some immediate supplies or assistance. We have those kits are located on Lopez, Orcas, and San Juan, and we are working with our resource center partners to have, if need be, them delivered to somebody who needs access to those items. And that's, again, that's part of that care coordination project that the state has rolling out that's going through the ACH and then to the 5 counties in our region. I just learned this morning that they are working on the final piece, which is signing the budget, and will provide funding for both our department and then as the resource centers provide this care coordination work, we would reimburse the resource centers. And so that contract is underway. And so there's some funding coming our way to assist with the care coordination for folks who are in the isolation and quarantine that will both help fund the work that we're doing, but also the work of our partners. So some good news there.
Good. Any questions of Mark or Jamie from the board?
No.
Good, thank you. Kyle Davies, CCC.
Thank you, Mr. Chair. Like Jamie's report, there isn't anything new since December from that group. Our next steering committee group meeting is the 5th of February, so we'll have something new from for next month. I know that one of the future agenda items is to appoint someone from council to join us. So if we need some background for that process, with Mark's help, I'm happy to provide some history.
So when is that? When do we need to do that, Kyle? Is it a next month's meeting or when? What's the timeline?
I see it on the agenda for this month. I don't know that it's required, but that would be for the 3 council members to sort of pick between them to appoint somebody. Bill Watson provided that role historically, or at least in the last year. So.
Okay, thanks. So any questions of Kyle relative to the CCC? We'll talk more about it at 11:55. North Sound Behavioral Health or Northwest Regional Council, I believe. Yes, Indy. You're muted.
The BHASO, is this what we're asking about?
Yeah, the NSBH, yeah.
Well, okay. Whatcom Crisis Stabilization Center is open. We have now 16 beds for drug-related crisis and 16 mental health crisis beds that are available in the region. Priority is given to Whatcom residents, but it is available for San Juan County residents as well. This is going to help, hopefully, with a diversion when law enforcement has to get into, intervene in a situation rather than taking somebody to jail who's having one of these crises. These beds will be available. Their Youth and Family Coalition, North Sound Youth and Family Coalition, is looking to build a constituency advisory council to develop and integrate youth-friendly, anti-racist social justice practices into its work, and they're looking for volunteers. North Sound Behavioral Health is looking for advisory board members as well. We have 2 vacancies for the advisory board for San Juan County, and that's a 3-year term. And communications between the state and the BHASO are ongoing in regard to the payback request from the state. They're still trying to understand how that transition between being a behavioral health organization and an ASO, where that left us in terms of owing money back to the state.
So that new facilities in Whatcom County?
That's correct.
Okay. And what about transportation from somebody from San Juan County? How do these people access that?
That's the question. I will find that out.
Great, thanks, Cindy. Any other questions of Cindy? Northwest Regional Council, Jamie, you've reported on that in the past.
Yeah, we haven't had another meeting, so that's the same report as last time, unless Mark's got some sort of update on any of the programs.
I don't. We are re-upping our contracts with the Northwest Regional Council. The Northwest Regional Council, I think, as most know, provides our contracts for the various senior services programs, so the information and assistance, the family caregiver support, and some other programs. And those contracts are annual, and I believe we're originally signed the last one, and those will be continuing into 2021. And so we'll continue with those services into 2021.
Okay, thank you, Mark. Any questions from the board? It's time for our annual election of officers. So I open the floor to discussion, nominations, or whatever. For obvious reasons, I'm staying out of
John
this.
Guyman. I would like to nominate Dr. Dale Heisinger after his excellent job as chair to continue as chair.
I'll second.
I'll second the motion.
Is there any discussion? Those in favor say aye.
Aye. Aye.
Opposed? We need a vice chair now, and Jamie Stevens has done a superlative job in that capacity. Not that I'm trying to persuade anybody, but is there a motion for vice chair?
I'll move to appoint Jamie Stevens as vice chair of the Board of Health.
Second.
Any comments? Those in favor say aye.
Aye. Thank you, Dale and Jamie.
Sure.
Thanks,
And
I'd
Mike.
like to know why Jamie's chuckling.
what's that, Kirsty?
I want to know why Jamie is chuckling.
Yeah.
We've had this Mutt and Jeff show going for quite a while.
Yeah.
It does speak for itself, I think.
Oh, and Dale, for the record, is it Heisinger or Heisinger?
Heisinger. It's a silent G. Heisinger. Heisinger, yeah. But it doesn't matter. I've heard all kinds. So thank you. And Jamie, thank you for taking over vice chair. Now we can talk about the Community Collaboration Committee, Kyle, that you had mentioned earlier. Mark, do you want to say some comments about this and see if we can get a position filled?
Sure. So maybe I'll also have Kyle join in and talk about this. So this is the Community Collaboration Committee is a work group that was formed, a committee that has been formed between San Juan County, Peace Health, their community health board, and the hospital district on this island. We meet roughly 4 to 5 times a year, generally on a Friday. Obviously with COVID, it's been over Zoom or another media platform. It's a way for the various health leaders to get together to talk about health issues, not necessarily just on San Juan Island. We're always looking to see if we can expand it to include the public hospital districts on the other 2 islands. But right now it is a committee for Peace Health. They use it for their community health board. It's items that we cover are we review the Peace Health community health assessment and the work they're doing there. So they have a what they call a CHA and a CHIP, and so they're looking at ways to improve health outcomes here on the island. It does benefit items across the county. And so we bring the voice from the Board of Health to say that the activities that we're doing and supporting are really countywide. They do support activities with some funding. And so some of the work that we do are we vote on some of the funds that Peace Health has through their community health fund. As an example, they have provided some funding for the Meals on Wheels program. And so they have supported that program countywide. They recently have voted to provide funding to the Head Start program here. And they've also funded the care coordination work group that looks at vulnerable populations countywide. And so it is it's been a good work group to bring together folks from both the Board of Health, from the hospital district, and from Peace Health to collaborate, to share ideas, and allow us to remain and communicate openly with each other. And so it is a valuable committee. And I think that in the past, the prior council members have found value in it. We come back to this board and provide updates. And so Kyle, I don't know if you want anything else to add in regards to the CCC.
Thanks, Mark. Just to say that I think the vision of it and the concept of kind of busting the traditional silos between standing agencies and efforts in healthcare has been very productive in my view. Worked through ACH actually in some other approaches in some of the other counties in the Northwest region, and very few places that I've worked or seen enjoy the level of interoperability and sort of mission sharing that this group does and this county has. And so it's great work, and some really great people are involved, and it's an opportunity. It's been great to have somebody from county government, even though it's through Board of Health, to have somebody at that level be able to weigh in and be informed. So I look forward for somebody to look forward to one of you stepping forward for that.
But as a council member, as you might notice, this is a very San Juan centric committee. So the person we have had, the San Juan District 1 council member has been willing to serve on this committee, but I'm willing to listen to anything on this one.
Currently, San Juan Island District 1 council member would love to sit on this committee. I have, in the course of, settling on committees, not found one within, the Board of Health parameters, and I would really like to participate.
Cindy, you have any issue with that, or?
Not at all.
No. Thank you, Christine.
Do we need a motion to accept Christie's desire to be on the CCC?
I move that Christine Minnie serve on behalf of the San Juan County Council on the CCC.
Okay. Is there a second? Okay, any discussion about that? Christine, thank you. Those in favor say aye.
Aye. Aye.
Opposed? Unanimous. Okay.
Christine,
Mr. Chair,
go ahead, Kyle.
I think you're going to say the same thing, Mark. I was just going to offer that first meeting then for the group at this point is the 5th of February. And unless you have objection, Mark or I will forward your county email. The agenda has gone out for that already, but if that's okay with you, we'll include you in that rotation.
Yes, thank you.
Great. Thanks, Kyle. COVID response update. Kyle, are you on board?
Yes, I am. Good morning, board. So I'm going to kind of run through some status, basically a situation report as it currently exists and then we can get into an update on where we are with immunizations. So I'm going to start with our local numbers. So currently we're at 96 cases in the county, and that's a representation of 6 new cases over the last week. And that's kind of been on the pace that we've been on over the last few weeks, as we have seen what we would call some post-holiday travel-related cases. For the most part, as we've done case investigations, we have tracked positives to whether folks either went off island to visit over the Christmas or New Year's holiday, or had visitors on island that then resulted in infections here as well. So that's kind of been our recent history over the last couple weeks. And again, as I mentioned, we have 96 current cases. Previously, at Board of Health meetings, I've gone through both the State Department of Health and the Governor's dashboard. I want to touch on both of those because there have been changes. You'll notice, so this I am projecting, and just confirm that you can see my screen. I am projecting the Governor's dashboard, where those of you that are familiar with this would have seen all the different counties and what phase they were in prior to the new change. So all this information has been grayed out as we have moved to the roadmap to recovery. So those of you that want to track this, these roadmap to recovery reports are issued at the end of each week. And so we're expecting one on the 22nd, but if we click on the one that came out at the end of last week, the State Department of Health now is reporting on regions and regional trends. So it's no longer a county by county phasing and counties moving independently. This is the picture of what the new regions, and there are 8 of them in the state, look like. All 8 regions are currently in phase 1. In order to move to phase 2, the metrics of the entire region, and these are the 4 metrics, so the 14-day rate of new cases per 100,000, 14-day rate of new COVID hospital admissions per 100,000, average 7-day % of occupancy ICU staffed beds, and 7-day % positive of COVID-19 tests. All 4 of those metrics have to be met by the entire region for the region to then move forward to phase 2. So again, that's a big change that has been effective over the last couple weeks, as the governor has really focused in on healthcare resources in the state as one of the most vulnerable due to COVID, and has grouped counties into these regions based on the available health care. So it's kind of a little bit of a history around that. So these reports, as I mentioned, come out weekly, and if the metrics are met on a Friday, then the region can expect to move to a different phase by that Monday. So pretty quick turnaround time. Again, we haven't had to move through a different phase yet, but we expect to be able to be quick on messaging that and what the different phases mean to local businesses. So this is the kind of the next page of that report card, if you will.
Hey, Kyle, can I ask a question? This is
Yes.
Jamie.
Yeah.
So if they're supposed to be reporting on Friday, and so that people could make a move on Monday one way or another, I mean, this is old. I mean, we're in the 20th of January and the reporting up there only goes through the 9th.
Sure. So, this would have been the report for the 15th. So had we been able to move to phase 2, that would have happened on the 18th. But you're right. They're using data. It's a little bit stale, of course. Like we've found throughout the response. Anytime they compile this, obviously a certain amount of time goes by as they're compiling it. So they're working off the best available data they can. So you're exactly right. There's a 3-week lag in the data, but that's the best available tool that they have out there. So it's definitely duly noted. But even with all the other old progress reports, there was again a lag there, and that's just a product of the state's data collection system and how overwhelmed they are trying to produce and keep up with the current metrics. So,
Kyle, could you go back to the different areas in the state?
The regions, you bet.
Yeah, the regions.
Yep. So
Okay,
we
thank
are.
you.
Yeah, so I didn't specifically mention that, but San Juan County is included in the North region with Island, Skagit, and Whatcom.
Okay.
So this report card basically shows the 4 metrics across the top there, and it gives a representative grade whether the metric is increasing, flattening, decreasing, or low. So in comparing the first report that came out on the 8th with this report, I can tell you that both of these metrics, the 14-day rate of new cases per 100,000 and the 14-day rate of new hospitalizations per 100,000, both of those have gotten worse. So we were decreasing or low in the rate of cases, and we were kind of flattening in this metric here. But both of those have gotten worse since the first report card on the 8th. Based on what we know of what's going on in our neighboring counties that make up the region with us, particularly Whatcom County, it could be quite some time before the region is able to move to phase 2. Whatcom County is experiencing a very significant spike in cases, and a lot of these hospitalizations are going to be attributed to St. Joe's Hospital in Bellingham. So that's kind of where to go. And if you're looking at the different phases and where we match up, this is the report card to look at. And again, this is going to be what we're told is this going to come out at the end of the week. And then if a move is allowed, then that move would be allowed by Monday. Now, obviously, there's no way to message in real time, but we're going to do the best we can to make sure that any affected businesses know as soon as possible what new allowances would be required in phase 2. So this is just some more details on how the regions were split out and some more detail on the metrics and how they're coming up with their data points there. But I wanted to go ahead.
This Dale, I have a question. I think we all anticipated that there's going to be a resurgence after the holidays, Christmas and the New Year's. Have you heard anything about when they anticipate that resurgence, the effect of the holiday celebrations will cause a decrease in the kinds of cases, hospitalizations, deaths, et cetera, that we have? Do we have another week of that? You know?
That's tough to say with secondary cases and the like. But I would expect that, you know, we're 20 days after the new year, and depending on when people traveled and got back, we could expect another week or two likely of cases. Again, in the region, we haven't seen that here locally, but this is a good enough time as any to kind of switch over to what's going on in Whatcom County. And I can show you the trend is that they're still going pretty well vertical. So this is where they were at the end of December, and this has been their experience leading up to it'd be right around the 10th was the last confirmed data. And then they've had some peaks since then. So I would say within the next week or two, those cases related to travel and any secondary cases moving through the 14-day observation period would start dropping off. It's going to be my best guess.
Could I? This is Frank. Could I just add something there? The other thing that's going on that may affect those rates, I would encourage you not to think that they're just going to go down. There are 3 mutations that have occurred, one in England, one in South Africa, one in Brazil. All of them lead to dramatic increased number of viri being produced and a substantial increase in the infection rate that it results from that. The one from England is now in more than 10 states in the U.S. Within the month, certainly, and I think potentially sooner than that, we'll likely see those same strains here, seeing perhaps a 50% increase over current baseline of cases of infectiousness. Generally, that's a fairly bad thing. Not all the strains are the same. The Brazilian one has some other features associated with it that are also not favorable. So I think we may see a somewhat of a dip coming up, but I think you need to be prepared to see a peak higher than the one we're seeing now within the month.
Thanks, Frank. Any questions of Frank? Kyle? Cindy?
When you say the Brazilian variant has some traits that are not favorable, could you elaborate on that?
Yes, it isn't clear yet, but it appears that that strain may in fact not be as protected by the vaccine as others are. The other strains appear to be fully susceptible to the vaccine's protection. The vaccine really works there. There is some question about the Brazilian strain, if it might modulate immunity in a way that renders vaccines somewhat less effective. Now, it wouldn't be that it wouldn't work; it'd be work less well. But these are very concerning developments, and I think ones that the problem being, I think we have in place a very reasonable surge capacity for our disease care system, not as good a plan for surge capacity like this for our public health system. If we, in fact, today or next week saw a 50% increase in cases, I think we would be struggling to deliver the same level of service, and we're in the process of developing strategies for delivering a significantly lower level of service, because that may be the only option we have. Yeah.
And to follow up on that, so when you're talking about the lower level of service, you're talking about being able to test and accurately trace where infections are coming from?
That's precisely the case, yes. Okay. Yeah. I mean, just so far, I mean, as I think all of you have seen in the news, San Juan County is an outlier nationally. We have had fewer cases, no deaths than almost any place else. Certainly any place of a similar size or a similar situation. We've done that by being able to isolate and quarantine people in a timely way and prevent community transmission. A couple of times we've had community transmission. For the most part, we've just had it come from off island into a household, and we've been able to keep it in that household by doing good contact tracing isolation and quarantine. That's a very time-intensive activity that requires a very well-trained person. It requires a highly experienced person to do a great job of it. Some counties have given up on that, and that's where you get these big spikes in cases where they can no longer do that contact tracing. Once you get community spread, it's a very different situation. In Whatcom, what happened is the leadership, the political leadership in Linden and Sumas think you shouldn't wear masks, and basically they just kind of given up, and that's really impacted the rest of the county and the rest of the region. In addition, there can be more infectious diseases like the variant that I believe is probably headed our way within the next month or so, maybe less. That too could lead to surpassing our ability to manage it in the way that we have. So far, we've had extraordinary outcomes. I believe that those extraordinary outcomes are at risk. And we may see community spread here. And community spread is something we just haven't seen. We're used to a very, very safe environment. That could change.
Thanks, Frank. Any other questions? Kyle?
Yeah, so I didn't want to focus too much on some of these other metrics. You know, I have in the past shown you the healthcare system readiness, but these are the old regions. So didn't want to focus too much on any of that. Basically, where we're looking now is that current report card that I showed you before in the roadmap to recovery. So this data here is not being kept up to date anymore. So any other questions for me on situation update or the like?
No questions? Kyle, thank you very much.
Yep, you're welcome.
Mr. Chair, I have one, Kyle Davies, one kind of more broadly. We asked last month of the department whether or not they had the tools and resources to, to move forward and keep containing at the level that we've been seeing. And I would ask that question again for Mark, and I at least earlier I saw Ellen on the call. So to all of you, how are we doing here, and are there things that we're not achieving, especially in light of this variant complication moving down the road? Are we where we need to be, or is there something the board could do in the way of staffing or similar to help?
Kyle, thanks for your question. It's changes like everything else with this response. It changes not quite daily, but it is always a fluid item. So last month, I don't think we were anticipating the need to scale up and be prepared to provide immunizations 5 days a week. We are now being asked to put a plan together to provide immunizations 5 days a week. And upwards of 1,000 immunizations providing a week, providing we have doses. That changes the staffing needs and model for our department, and we are working through that now. We are training staff in a variety of locations, including today at our venue here. These are both staff from the county as well as volunteers. And we've been training staff for the last couple of weeks, both immunizers and other staff, and using outside agencies. So that is an evolving picture. We're also seeing more of and we're getting kind of into the vaccine question, but it plays into this idea of what staffing needs are. We're seeing more of our providers get enrolled. And as more providers get enrolled to provide vaccine and start receiving vaccine, it may shift what our priorities are and provide different staffing models or needs that we have. So that it is a fluid and dynamic situation. But as of today, we are gearing up to be able to provide 200 doses a day, 5 days a week across the island. which then also creates challenges because we have to move from island to island. It's not like just setting up in one location and providing these, which would make it a lot easier for us and changes the staff needs. With that, because we're doing that, we've actually have pulled a person from our surveillance team to assist with vaccine, and we're looking to backfill and to provide some additional staffing there. We have volunteers that we're looking at to see if they're able to do that job. It does require that somebody is a little bit tech savvy. So we have lots of people who want to help, but sometimes the help is actually causes more work than it actually helps because of the navigating the state systems and so on and so forth. So we are looking to backfill on some of those positions. We hopefully are making an offer later this week for one of the positions that council approved for our community health worker, which will provide us capacity. That person will be assisting with our surveillance team doing the symptom checks and care coordination, which will provide a significant relief for that team and additional capacity. And we still have a vacant nurse position, and we received some applicants for that position. Also would provide some additional capacity that we currently don't have. And so we'll need to go through and to interview and to hire that. The county and through the county manager have indicated that this is a top priority. And so we have staff from some other departments that are assisting us with phone calls and around the scheduling. And we have onboarded 3 additional emergency response volunteers, former county employees, that will be coming in to provide help for scheduling and data entry on all these items. So our staff and our team is expanding. That takes time for us to onboard and train. And in certain positions, we have to have the right function and the right skill set. And so we're right now it's a little bit hectic for us, but I think that with the staff, we are onboarding, getting set up with some of our data or our computer stations and everything else. We're going to be in a much better or a much different picture next week. And again, as we find out what our providers' intentions are in around the immunizations and the vaccine supplies they're getting, it may change our picture significantly as well from how much we have to commit to do the immunizations. And so it is a fluid and dynamic situation, and we have a significant number of staff we're onboarding. We're Lopez, and we're going to, again, kind of getting into the weeds here a little bit, but in the vaccine front, we're working closely with the pharmacy over there and a group that has formed former nurses and other staff that are assisting us. And we're going to have the team on Lopez between staffing our clinics and their clinics. I think it's going to be well staffed. And so again, it's things are shifting, things are moving, but we're in a I'll know more next week on where we're at staffing wise, and again, filling some of these key positions and what we're doing. I think we're going to be we'll know more as we move forward. So long answer. I don't know if it answered your question or not, Kyle, but a lot going on, a lot of moving parts.
Okay, thanks, Mark.
Thank you, Mark. Kyle, any other questions?
Christine has her hand up.
I do.
Oh, Christine, go ahead. I'm sorry.
No problem. I do have a question before we move on to vaccine topic. Is it possible to be more specific about what the recent cases being the result of off-island travel means? Are we talking about traveling to, in an airplane to other states, or are we talking about people simply going to Mount Vernon?
Yeah.
Dr.
So,
Jane, the answer is both. I mean, we certainly see a significant number of people that have traveled on a plane a great distance. That's a risky thing to do. And if people are not careful, there's definitely risk of bringing disease back. But there are also people going to Costco. There are people going off island. just on the ferry and driving back in their car, both. The reality is that high risk is certainly in some other big cities, but high risk is in Whatcom County. High risk is in Skagit County. High risk is in Island County. So you don't have to go a long ways to see risk. And whenever you travel, you got to use the bathroom. A public restroom is not a very safe place to be. I mean, I wouldn't go into one without an N95 mask on. We certainly see people from off island with the disease. But right now, the wonderful thing is when we do these case investigations, you just got to find the person from off island and you know where it came from. If we get sustained community spread, that's not going to be the case any longer. It's going to make contact tracing considerably more difficult. But you're right, and I don't think it's not just people traveling to Mexico on vacation. It's not just people going to Arizona. It is people going off island for other reasons. Because again, you can look at the rates. I think the rate in Whatcom is 418 cases per 100,000. That's like that's a huge number. And the same, and our other counties are not that bad, but there's really significant disease going on. I mean, we are outliers, and we live in a world that's not the same as every place else. A very different place than risk-wise than it is just a ferry ride away. And we've always recommended that people isolate and quarantine, and we can order them to if they're sick. But the quarantine after travel is if people travel, they need to quarantine. They need to stay at home as much as they can because there's real risk in that. And we certainly see people coming back and bringing disease here in that way.
Thank you.
Okay, thanks, Frank. Kyle, did you have any comments?
Dale, could I, just one more thing. I'm going to have to go because we've got to get to the vaccine clinic. I got to get over to. But the other thing is opening schools. And fortunately, that's not our bailiwick. That's school district's thing to decide. But with the rate that we have, our regional rate currently today is 338.9. So almost 330 cases per 100,000. So opening schools is going to be really difficult to do. There's this funny transition area in the middle, and then the rate where in-person education is fully sponsored by the governor's criteria is going to be 75 per 100,000. We're a long way from that, and unfortunately, and school is really, really important. We need to get schools open as soon as we can, but we have to do it safely. And so if this is the peak and we go back down, then we could be looking at that. But as I said earlier, I don't think that's going to be the case. I think we are still on the way up with these new strain. When it reaches us, I think we're going to see a bounce from that. Now, we won't see the bounce they see other places. I wouldn't want to see the bounce that Whatcom County is going to get from those strains when they arrive, because they've got widely dispersed disease already. But it will likely replace those other strains. In England, it took a few months, and it was most of the cases were the new strain. So we will see it come in and replace the current virus with a whole new virus that's more susceptible. It just outperforms the other virus. So that's one impact of the metrics piece that didn't get mentioned, is that there is a real impact on reopening schools with those numbers being so high in our region. And not only is it we share a healthcare system. That's a really rational reason. But I've been arguing and actually using a regional model for many months with respect to schools, because our risk is regional. There's no people come and go between here and Whatcom and Skagit and Island all the time. And so our risk is really regional. And when you have a small population like ours, the numbers, they go up and down very dramatically with just a few cases. So regionalization makes a lot of sense for many, many reasons. And I think it's absolutely the right thing to do. And we've been politicking to get the governor to do that for some months, to get him to do that. I'm really glad he's doing it, because for small jurisdictions like ours, our rates are going to go up and down with just a few cases. And so it's important to regionalize it to get a more accurate picture and a more stable picture.
Thanks, Frank. Any other questions?
I am going to sign off and get over to the clinic now to see the patients that have questions.
Great. Thanks, Frank. Thank you.
Bye-bye.
Ellen, are you ready to talk about the vaccination efforts of San Juan County?
So Ellen is actually not on Dale. She is at the clinic.
Okay.
So
And so,
yeah, I will provide the update. So where we're at is currently the San Juan County staff were the primary folks providing immunizations here in the county. And so I think everybody's aware that the initial group was called Phase 1A. That Phase 1A were healthcare providers. They expanded the definition a little bit. It was healthcare providers, first responders that had direct patient care. They clarified it, and it was they had more of an inclusive healthcare system. So, we had dentists, we had behavioral health specialists, we had in-home healthcare folks, certified folks that were taking care of people at home, and we in turn expanded it as well. We, for the most part, have completed the Phase 1A initial shots, and that includes at our 3 long-term care facilities here in the county. There were a couple partners that did some of the immunizations. So UW clinics came up and provided immunizations to the medical teams in their offices. And if they had or anticipated having extra doses in the vial, they reached out to us and we linked them with some other 1A people so they could use all the vaccine. And then Peace Health also has provided some shots to some of their staff within their system. So once we're through this week, with the exception of maybe a few stragglers, everybody within the 1A symptom, the Phase 1A category is complete, and with their initial shot. Second shots will be happening for the people who got their initial dose on December 30th and 31st next week. We are currently doing clinics 3 days a week. So on Wednesdays is San Juan Island, Thursdays is Lopez, and Friday is Orcas. As I stated before, we are training a variety of staff to fill roles. These are clinics where, as you can imagine, when you're bringing right now about 60 people into a building on San Juan Island, you stagger them. You want to keep them 6 feet apart so we're not creating any opportunities for folks to spread illness among themselves. And so we have folks who meet them, greet them, make sure they're on the list. There are folks who explain the vaccine, and then we have vaccinations stations. And then we have to, with this vaccine and some of the potential for anaphylactic shock, very small potential, but because it exists, we have them wait for a minimum of 15 minutes if they've had no experience in the past with an adverse reaction, and 30 minutes if they've had a prior reaction. We are utilizing our partner agencies and thank them very much. So San Juan EMS is on site on our clinics here with a EMT and or paramedic. On Lopez, it's the Lopez Fire Department, and on Orcas, it's the Orcas Fire Department. And they are being that they're observing the individuals and are on standby in case somebody has a reaction. Because we're expanding to 5 days a week or looking to expand, we've also have commitments from San Juan Fire and Rescue here to do one of the days here as well. And Lopez will still be 1 day a week, and then Orcas, the Orcas Fire and Rescue, will be planning to do those 2 days a week. So we're filling out that roster with our partners to assist us to provide the assurances that if somebody has a reaction, that we have medical staff there that can quickly take care of those individuals. We are receiving the Moderna vaccine, which requires 2 doses, 28 days apart. So individuals you do today, 28 days later, receive their second dose. So starting next week, we will be doing what is called the prime dose on 60 individuals on this island in the morning. And then in the afternoon, we'll be doing 60 second doses. So 120 folks will be getting immunized next week, 60 prime and 60 folks that require the second dose. That then starts rolling through the schedules, and you can see you can quickly get to 200. So the goal would be to do 100 prime doses and 100 of the second doses as we move forward, which gets you to your 1,000 a week. The vaccine supplies are limited, and so the thing for this board to understand is that we have to make a request weekly for an allocation. We hear later whether they're going to approve that allocation or not. So as an example, we made a request for 300 doses last week, and we heard we were getting 100 doses. So we got 100 doses this week instead of what we asked for, which was 300. That then complicates, as you can imagine, trying to schedule clinics. We don't want to schedule clinics and then have to cancel appointments. That would be a nightmare for us. And so our team is working to schedule the slots based on best available information, and to only schedule slots for the doses we have. We are aware of some of our healthcare partners that have recently got through the approval process with the Department of Health. And so on Lopez, the Lopez Pharmacy is approved. They submitted a vaccine allocation, and I believe they have received vaccine and will be providing shots on Lopez based on the numbers they received. The Peace Health system on this island consists of two parts, both the hospital and then their clinic. The hospital was approved, I think, 2 weeks ago. They have received some initial doses, which they used and are using for their healthcare providers. Their clinic was approved yesterday, and so now they are eligible to make requests for allocations. Eventide Health on this island was approved yesterday, so they can start making allocation requests to receive doses. And Friday Harbor Drug, their refrigerator, I believe, has been approved, and they're working to get their freezer approved. On Orcas Island, Orcas Family Health Center has been approved. And so now that we have these folks, these partner agencies approved, they can start making requests for vaccine allocations. Again, the request goes in weekly, and then you find out a few days later what you actually are allocated, and then it shows up for use. Most of our partners have indicated that they don't want to, they want to really follow what we're doing and to schedule appointments based on known quantities. So they're not scheduling more appointment slots than they have vaccine for. And so it's kind of a little bit of a scheduling game right now. And so we're moving through and trying to understand what their intentions are, what kind of volume they're expecting to receive. And obviously, the more doses they do, the better it is for us. And ideally, our healthcare partners will be doing the bulk of the immunizations going forward. The other thing I want to cover, and I'm sorry this is a little bit disjointed, is that the governor announced on Monday that we are moving into the phase 1B tier 1 population for immunization. So that phase 1B tier 1 population was announced Monday. We issued a press release right after the governor's announcement, and that opened it up to two groups. The primary group was folks who are 65 and older. That group is a little over 5,000 county residents. So there's about 5,000 people that are 65 and older here in our county, which is a very large group when you're getting 100 doses a week to serve. The second part of that were people between 50 and 64 that live in multi-generational households. That has been further defined and it's a specific definition. I don't know, Kyle, if you can grab it and open it up onto your desktop. I didn't have it handy, but it really is intended for individuals who are not able to live on their own and that are between 50 and 64 and have somebody working outside their home, or some younger people and or folks who are caring for grandchildren that are outside their home more frequently. So I don't know if Kyle, if you could find that and get that open. Thank you. So again, it's for people who are over the age of 50 and are not able to live independently, who either are receiving long-term care from a paid or unpaid caregiver, or living with someone who works outside the home, and then people over the age of 50 and are living with and caring for a grandchild. It is not intended for a lot of the folks that I'm aware of here in the community, myself included, who's over 50 and has one of my children living with me at the present time, and so I would not it would not apply to me. So this would be for the categories you see there. And so that is the phase 1B tier 1. We anticipate that there are between 5,500, a little over 5,500 people countywide that fall within the phase 1B tier 1. And so it's a very large group. We did release a online sign-up tool with our press release on Monday. Within the matter of about an hour and a half, all available slots for the next 2 weeks that we had available were full. We received a significant number of calls yesterday where people were asking if we had additional slots, which at this present time we do not. There's other asking about our healthcare partners, and right now there are no other vaccines and that I'm aware of, and the folks who have it are working through their clients. So long way of saying that we have this new tier. It's a very big group, like I said, about 5,500 people countywide, and we have limited vaccine supplies. And we are today we'll be providing shots to folks who are in this group at our clinic here, and again on Thursday on Lopez and Friday on Orcas. So I'm going to stop there and ask if there's any questions.
Mark, I got a question. Back to the people who are over the age of 50 and are not able to live independently, who either are receiving long-term care or a paid unpaid caregiver, or are living with someone who works outside the home. The living with someone who works outside the home, is that, and in combination with living and not able to live independently, is that metric an economic metric? Like they can't, they don't have work and they're relying on their spouse? Or is that meant to be you can't live independently because it's a disability issue?
The way I understand it, maybe, Kyle, go ahead. You're going to say something.
Yeah, so just to dive in a little bit deeper on that, Noel. So really what this is getting at is folks that can't live independently and would typically be in a long-term care facility, but for whatever reason, they're not, and their family is taking care of them. So this is equating the population that isn't in a long-term care facility, but is being but could meet that qualification. They're just being cared for at home, and there's a risk because somebody in that home is also working outside the home, potentially bringing back an exposure.
Okay, I would suggest clarifying that for the general public of what the intent of living independently is, because of the socioeconomic issues we're having right now. People are not able to work. Therefore, they're not able to live independently. They're having to rely on other family members. Households are are coming together, and that could easily be misinterpreted.
Yeah, thank you for that feedback. The one part I didn't touch on this is that the state has a program that's called Find Your Phase or Phase Finder. I've heard it called both. That walks you through questions to determine if you're eligible or not. I have not answered the questions to see what it would look like in this realm, and so we will take a look at that to see what that looks like. Noel, I think it's great feedback to see what kind of questions they're asking, and so it is intended kind of what Kyle was talking about. And for us, we had asked that those individuals utilize that program and to verify that they are eligible and they meet these criteria, which is through that Find Your Phase, our Phase Finder. And it, again, walks you through a series of questions to determine whether or not you are eligible under this tier. And so we will take a look at that to see what it looks like. I know this was a question that multiple counties have had, and most of them are relying on that Phase Finder to allow people to go through, answer the questions to determine if they are eligible or not.
Mark,
yeah, go ahead.
Yeah, I was just going to say, Kyle Davies has his hand up, as does Cindy Wolf.
Yep. So, Kyle, I saw yours first. You're on mute, Kyle.
Thanks. I note margin here a question, and I know we're a little long on time, but I think it's important. Can you snapshot what testing looks like in the county right now in terms of access for the average person?
Sure. Let's see if Cindy has a question regarding the vaccine before moving on to that.
I do. As we wade into this, should people be prepared to go back to the provider they get the primary shot from in order to get the second shot? That's one question. The other question was, is there any more information about why there's a distinction between 50 with a grandchild and 50 with a child?
So answer to your first one is yes, they should go back to the provider that provided their initial prime dose because that provider is receiving, as part of the allocation, the second doses are being automatically shipped to the provider. So as an example, for the 400 doses that we have provided, we are receiving the second dose to provide the shots to those individuals. And so folks should be going back to the organization slash primary care provider that provided that shot. The answer to your second one is a good one. I think the idea behind it is that a lot of times these folks who have grandchildren, those grandchildren are going to other houses, maybe houses of the parent, going elsewhere, and there's more exposure risks. But I don't know. Kyle, do you have anything more beyond that?
That's all I was going to add is that the bullet point where that occurs is under risk of exposure. So I think it's around movement outside the house and potentially not being of an age where the social distancing and the mask covering is 100% compliant. So then the possibility of bringing that back to a vulnerable adult.
A lot of those households, again, these are grandparents who have their grandchild, say 3 or 4 days a week, and then they go to one of the parents' house and then the other parent's house, and so there's a lot more potential for the risk for those individuals. So,
thank you.
Any other vaccination questions, or we can ask Kyle's question on the testing?
Looks like Chris.
I
Yes.
do have a vaccination question.
Okay.
Thank you, Dale. You just said something to the effect of the second dose is automatically shipped. And so in that case, when we request an allocation and we only get 100, is that for a prime dose and second dose is considered something else, or is that for both?
So the way we currently understand it, Christine, is when we receive the allocation of 100, The expectation is we'll use that 100 doses within 1 week. 21 days later, we would automatically get the 100 doses that are considered the booster or second dose. So that will be shipped separately. We would not have to make that allocation request. The state system would automatically ship us that 100 doses. So.
Okay, that answers the question, Christine. Any other questions?
Yes,
okay, thanks. Any other questions?
So Kyle had a question regarding testing and the testing capacity. So right now, our healthcare providers are doing the testing and are able to meet the current needs for folks who need to be tested. And so there's a variety of different mechanisms that they're utilizing. So we have test capacity on all islands. They're currently meeting the need of anybody who is symptomatic. Orcas Island and the Orcas Family Health Center has stepped up, and they're doing some drive-through clinics that they move and rotate around the island over there. And I believe the group on Lopez is doing some of that work as well. Jamie, is that correct? Or they have capacity if need be. We also work closely with the providers, and in the event that we need to have ring testing around positive cases, we're able to arrange orders and have and work with the clinics to have the folks go there and get tested at this time. We do have the ability, if need be, to provide that testing. And again, that would be stretching our teams, but we can, if need be, stand up and provide that ring testing around an outbreak. We're fortunate right now. We're in a position where we're able to provide those orders and have the individuals go to one of the healthcare providers on the island. And it's knock on wood, it's worked for the last month and a half.
Okay.
Thank you, Mark.
Thanks, Mark. Anything else relative to COVID? Mark, we want to talk about the bills of interest from the state that are being considered and could impact us in various ways.
Sure. And so it's not like I've had a lot of time to do a lot of research on various bills. But these three, I thought let me just share my screen. And I think that, and Jamie probably is like, well, Mark, we're already working on this through the council and the WASAC. But these three had caught my attention and thought the board may be interested in that. So the first one is this House Bill 1152. This bill would completely change our current local health structure and focuses on a regionalization model. And so it is something that would change the structure of local health. It would look at creating regional health districts. It has certain minimum sizes, and it would direct some of the foundational public health funding to those health districts to provide those services. I've quickly scanned it and have some significant concerns for our community. I think that if you look at the background and the purpose of the bill, it really San Juan County is not in the shape that they're listing in the background within the bill. San Juan County has stepped up in so many ways to provide public health services here and respond to this crisis. And our numbers show it. What we're able to do is incredible. And I have concerns that if we go to a regional model, it will really impact the service delivery to our citizens. And so I know they're talking about providing some comprehensive funding for some of these services. But with a lot of this, the funding may be there initially, but as you go through time, the funding decreases, and generally what happens are geographically, rural, geographically hard to serve areas start to lose services. And so I'm concerned about this. I know the Washington State Association of Counties is concerned about this. And I know Jamie's probably been on some calls in this regard, but it's something that we need to spend a little more time looking at. And so it is a concern of mine. The companion bills are the House Bill 1201, and it looks at increasing the amount of funding for foundational public health services. But that bill is that 1281, the way I read it, would only go into effect if you create these health districts. So I mean, I think it's a good bill, but I think it needs to be looked at to maintain some local control and provide that funding at the local level. I think there are some things we can do regionally, and I think that our region has done items regionally. So we have worked and we continue to work on what we call epidemiology and assessment work to pull data that are relevant for community health assessments. I think we can do regional work around tuberculosis. And I think that, you know, if there's opportunities and the associated funding, most of the counties would work on a regional basis for some or more of those specialty items. And so I think there's maybe could be a hybrid that can be looked at in this regard. The last one is the House Bill 1110. This one doesn't have as significant of an impact for us, but it looks at how the composition of local boards of health. We're already an expanded board. We already have non-elected members that sit on our board and provide the perspective from that. This would require that the composition change statewide for the local boards of health. So in a lot of jurisdictions, the three county council or three elected officials, whether the county council members or commissioners, turn their hat around and become the Board of Health. This would change that and require that they go out to non-elected members. The one area would be a little bit different to us. Either we'd have to add an additional member or we would change the position for the town because, well, the town right now is filled by an elected member, but I guess it doesn't have to be. They can appoint somebody else. They've chosen to appoint an elected individual. So I think as it's written, the way ours is written through the charter is probably fine. It just so happens that we happen to have an elected official appointed by the town. So I just wanted to, I mean, unless one of you has read these bills and have comments on it, I wanted to bring these to your attention. And I don't know if Jamie has any comments from WASAC. And I know that the 1152 is on their radar screen. We'll stop there and ask if there's any questions and try to figure out what our next steps may be, being that we're kind of immersed in the COVID response.
But what's the timeline on this? When do you anticipate the legislator will take action?
They're in session now, so they're starting to discuss these bills. And I'm going to defer to Jamie, who is much more versed in the inner workings of Olympia than I am. So not to put you on the spot, Jamie, but you know the process much better than I do.
Well, on the 1152, as it has on the blurb you sent out, there's the first hearing on it is in committee tomorrow in the House committee, tomorrow at 10 o'clock. I know that WASAC and the Association of Public Health Officials are both opposing this bill. The regionalization, you know, I think Dr. James brought up a good point earlier. Regionalization helps you get the metrics better, but it's not necessarily better for the delivery of public health. If you probably don't recall the regions when they were up on the screen, but the first region, on the East region, is pretty much taking one big line and going around a whole bunch of counties straight down the state. And that's lumping people on the southeast corner of the state in basically all because of Spokane. And even in this vaccination world, and hospitalization world, Spokane is hospitals are crowded, not because of what's going on in Lincoln, Chelan, or Lincoln, Yakima, and other counties in that area. It's happening because people in Idaho can't get themselves under control, and their hospitals are full, and they're spilling over into the Spokane area. So, you know, some of these regions, unless they change the regions to smaller areas, might not make sense to do it that way. And in the 1201, that companion bill, I'm not as well versed on that one, but it does add more cost to the system without really figuring out how that's going to be delivered. And I think Mark gave a really good synopsis of particularly 1152 and the dismantling and regionalization, particularly in rural areas and in a county like ours where people have to travel. We've already seen the effects of some of this when Compass Health has to provide mental health services, and they can't fill a spot out here, so somebody's spending a couple hours a day instead of providing service, they're on the ferry.
So Jamie, is this something the Board of Health should respond to this committee to let them know what our concerns are relative to our county?
I think maybe after, well, it'd be pretty hard to get it together before tomorrow, but maybe after the hearing tomorrow, it might make, well, then we don't meet again. Sorry, not thinking ahead there.
But if can this wait until the next Board of Health meeting, or do we have to act on it sooner?
We'll probably have to act on it sooner.
Okay. Is there a way that we can get information to the Board of Health relative to the outcome of that committee meeting so we can then make a decision about how we wish to respond as the Board of Health?
Sure, I could make sure that you got, that the board gets information on it.
Okay.
The other way too, Dale, is click on that link and you can actually track the bills and it'll show you what's going on with those bills as it moves through the legislative process.
Okay. So we just go to the state government and look for those bills and now can get the information from that.
So if you actually click on that, there's a hyperlink in that document that I posted to the site. And so when it's underlined like that, if you click on that hyperlink, it'll take you to the bill. So let me just see if I can call it back up quickly. Just a second. Dale.
Mr. Chair, I took a quick look.
Excuse me, I have my hand up.
Oh, I'm sorry, Cindy. Go ahead.
Thank you.
Kyle, hang on.
I have significant concerns about how this bill would affect our services in terms of our hospitality industry as well. And I'd like to hear if anybody's thought about that. We have so many restaurants and hotels, and I am concerned that being an archipelago and being a very small county, if we were regionalized, those services could get lost in the shuffle, and we wouldn't be able to take care of our businesses the way we need to.
Jamie,
Yeah.
do you have insight relative to that?
Me?
Yeah.
I think it'd be more probably myself, Dale, or Kyle.
Okay.
So
Yeah.
what I have heard, but again, there's a lot of unknowns with this, is that certain services would remain local. And again, this is my concern, is that depending on how things are set up, they can expand and contract the district, and that's when you start losing that local oversight. So as of right now, as you were talking about, Cindy, we licensed and work with our local food providers as far on the food safety front. If it's a regional perspective, depending on the structure of it, it may mean that that service is being provided from Whatcom County. And as Jamie says, depending on how far it goes, they may want to send inspectors out on the ferry, which then doesn't really provide great service. And you don't have that. You can't just pick up the phone and say, well, I know it's, I can call and talk to Kyle Dodd and he'll pick up my phone or answer the phone call. So there are impacts across it. So I'm not sure if that's what you were asking, Cindy, because that's how it would impact the, in the hospitality world, is you wouldn't have that local friendly face be able to walk into the office potentially. Now, that all depends on funding and how much money is put into it, and if there's certain requirements that you have to have staff in the various counties. And so there's a whole bunch of unknowns at this point.
Cindy, does that answer your question?
It does.
Kyle, you had your hand up. Kyle?
Thank you, Mr. Chair. Sorry, Commissioner Wolf. I just took a quick glance at both of those, and just for note, it's interesting. 1152 has Representative Lekanoff as a co-sponsor, and 1201 has Representative Ramel. So I don't know quite how that can be incorporated in whatever you do moving forward, but interesting that they're two local people, and I certainly haven't been approached by either of them about their thoughts.
Okay.
Yeah,
Any other question?
So Gail, just real quickly, it won't let me do it from my computer, but if you hover over the link, it says Control-click to follow the link, and it'll take you right to that bill.
Okay.
And so with that number, you can also follow it the other direction, but that will allow you to, it is a hyperlink, and it'll take you right out to those, to the bill itself. So.
Okay, so we can review that. The question I have, Mark, is what we can do as a Board of Health, and in what period of time, if in fact the information that we are all going to read suggests that we're in opposition to this.
So I think there's a few things is to analyze the bills, fully understand them, and then monitor the progress. Jamie, I don't know if this is on the legislative priority list for the council or not. And, there's potential to come back in February, depending on how fast this bill goes, to craft a resolution in opposition to it. I mean, they do get changed as they move through, and so you kind of have to keep on top of them. But only meeting monthly, we may just want to have Jamie keep the group informed, and I'm guessing that individual members could and again, I don't know if this is on the priority list, Jamie, for the council. Is this on one of the priority lists for the council?
It is part of, well, it's not on our council one, except in supporting the WASAC priorities, of which foundational public health is one of them, but not regionalization. Okay.
So would it help the council if the board, individual board members, if they have concerns, would share those with the council members so you guys were aware of those? And then we can look at, depending on how this bill goes, come back potentially in February with either a letter or a resolution expressing our concerns at that point in time, in whatever form or shape that the bill may be in.
Jamie, are you comfortable with that?
Yeah, I'm comfortable with it. I was
okay.
Looking to see if Christine and Cindy were nodding their head one way or another.
Okay. Cindy?
I'm wondering if in the short term, it might be a good idea for council members to make phone calls to Representatives Lekanoff and Rommel to let them know that we do have some concerns upcoming.
Anyone else?
Well, John Guyman here. I would note, given this last discussion here of regionalization, the parallel with our excellent Hospice of the Northwest, which comes out fine without regionalization over to all those other counties. So we too much regionalization can hurt us.
Any other comments? So, first of all, it sounds like we will all review these documents that are present and then get a good handle on what's going on. And Jamie will inform us as to the progress in the legislature, and then hopefully we can deal with it at our February Board of Health meeting. All right. Cindy, I haven't heard other comments about writing to representatives to give us our opinion. I have concerns about doing it prematurely until we have sufficient data to give us a position where we're informed. So that would be my only reservation. Anybody else? So I would suggest that we hold that thought until we get more information. We review it, we get information from Jamie of where we're going, and we'll stay in touch. If things look like it's moving fast, we can respond accordingly. Is that, people approve of that? They're okay with that? All right. Any other questions of Mark relative or Jamie relative to this?
I don't.
Okay. We've got, yeah, Kyle.
I just wanted to thank Mark. That was a priority we made last year, and it does make a difference to have some heads up as a group on these things. So thank you to you for especially as busy as you are, for doing that. I appreciate it.
Good. Thanks, Kyle. Any other questions? We've gone over time. My apologies. I think it's time that we adjourn. Do I hear a motion for adjournment?
So moved.
A second.
Second.
Who objects?
15 seconds.
Okay. Those in favor say aye.
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 Opposed? We're adjourned. Thank you all very much. Mark, thank you.
Yep, thank you.
bet.